So in a broad basis, we try to classify, even on the babies which are born is like pink baby or blue baby, right? So the pink baby is the acyanotic, and the blue baby is the cyanotic one, cyanotic heart disease. So in the pink baby, what is going to happen is there will be a volume or pressure overload. So can someone give me some examples of the acyanotic congenital heart diseases? Any example? You can use the chat box. Otherwise, to try to make the concept more clear, what happens in the blue baby, in the the cyanotic one? So the cyanotic one, what will happen is there's either less or increased pulmonary blood flow. But of course, the baby will be cyanosed. So what are the examples for that? So the baby, as I was telling, the wall pressure. Okay, so maybe it's really pink, but the problems can be is PDA, patent ductus arteriosus, the DSD, or ASD, even coagulation of aorta as well. Okay, how the babies are the ones. What will happen is the dirty blood, the deoxygenated blood, is going into the systemic circulation. So that is going to happen through tetralogy of Fallot, transposition of great arteries, and the tricuspid atresia. Yeah. So, coming to the atrial septal defect. So, what happens is we all are aware that not only this is the most common uh, congenital heart disease, but also, in fact, as we all are aware, like up to 50 to 70% of the congenital heart disease are the ones which will be typically even ostium secundum. In fact, ostium secundum is there, primum is there, and sinus venosum. So even in the ASDs, the secundum is the most common one. Then comes the primum, then comes the venosum. So ASD is more like an abnormal opening in the atrial septum, which allows oxygenated blood from the left atrium to mix with the deoxygenated blood in the right atrium at a minor pressure difference. And the right atrium receives blood from the superior vena cava, from the inferior vena cava, as well as from the left atrium. That is the one which leads to volume overload and also pulmonary congestion. And as I said, it like on an overall basis among all the congenital heart disease, the occurrence rate is like 4 to 10%. And yes, it is more common in females. Okay. For the ostium secundum, as I had already said, see, even on a normal basis, the ASD patients are mostly asymptomatic. But with the passage of time, over years to decades, patients may experience those symptoms depending on the type and the severity of ASD. In fact, those kids will be getting tired during the feeding. And what will happen is even the babies eating, so they will be having shortness of breath, fatigue, sweating, palpitations, or even their milestones of growth will be retarded. Okay, so ostium secundum is presented part of the set. Primum is the which blue. The diagram is useful. You can see. So them as venosa. Okay. So why it's called this? Because it's at the site of the superior vena cava. This. What is this diagram which you can see? Everyone uses that, right? So is this. This can be a typical EQ for you guys. They will show and they will ask, what is the diagnosis? So this is a phonocardiogram, okay, on rotating. So what you notice over here is S1 is normal or abnormal. So S1 is normal. And in S2, you
No.
notice something special.
Yeah, वो
So it is widely
लोकेशन भेज दिया मैंने
split
बंद
and
ठीक ठीक है ओके थैंक यू
Okay. Aditya, please mute your microphone. Thanks. I know your order has been sent. We all can hear now. So S2 is widely split and fixed with accentuation of the P2. And what is the type of murmur which you can hear? It is called as a injection systolic murmur, right? So S1 is normal, S2 is wide and fixed split with P2 accentuated. What is the expected findings on a chest x-ray of a patient like this? So what do you think? What do you notice over here? We had a session also on the chest x-rays, right? So what do you notice over here? I have also put up the markings to make it easier. So for example, on the basis of cardiomegaly, what do you think? So we can notice there's mild to moderate cardiomegaly. And there, how about the right atrium? If you'll notice, is it normal or abnormal? Of course, the RA and RV are both enlarged. And then the pulmonary artery segment, they're prominent, isn't it? And even the pulmonary vascular markings are also prominent. So this should make our suspicion about ASD. So can someone recall what did we learn in our just last one or two sessions about the ECG changes? What do we notice? So the first thing was right axis deviation. Yeah. Right bundle branch block. We also notice over here. And there's RV strain pattern. Isn't it? RV strain pattern because the QRS is positive, but the T wave is negative over here. And what else do we see? So looking at this ECG, if you get this, how will you say ostium primum or secundum? So it is right bundle branch block with left axis deviation, which means it is osteoprimum. Yeah. And if it will be right axis deviation, then it would be ostium secundum, isn't it? What was there were so many signs also we had spoken about when we did our only ECG session earlier. Anyways, so regarding the management, so what happens is most of the babies by the end of the first year itself, it will close. However, if the baby's heart hole size is of like 3 to 8 millimeters, they may need supportive medical management using digoxin, diuretics, and also the prophylactic antibiotics, in fact. Okay. And yeah, a lot of times it may get closed as well with the passage of time. However, some of those patients may need, if the defect is more than 8 millimeter, surgical repair will be needed. And if spontaneous closure does not occur by school going age, the surgical repair becomes essential to prevent lung problems that will develop from the long time exposure to the extra blood flow. And the surgical repair should be done, yeah, with a stitches or a special patch. The material which is utilized for the patch closure of ASD may be the patient's own pericardium, in fact, and or even sometimes maybe like the bovine pericardium, or what is called as MSET. There are some of those Gore-Tex, Dacron, commercially available stuff as well, which can be used.